video from the CTAG clinic. My name's Dr. Mike Lloyd and I'm the clinic director. In today's video we're going to be looking at a follow-up from the previous video about why am I dissociating now. So this video is looking at why dissociative events happen and then what it is that people can do about it once that has started to take place. First and foremost, this is something that is always best done within the therapeutic setting, so to work alongside a therapist to be able to fully understand the nature of these events, because each one is individual. It's very difficult to get sort of general advice and commentary through a video like this, so I would recommend that this be done properly within the therapeutic setting. However, there are some things that a person can do if they're stuck and if a dissociation is taking place in the middle of life, there isn't the therapist available, it can't be worked out, and it's simply something that needs to be handled and managed in that moment. There are a couple of things that can be done, and that's what we're going to be touching on in the video today. The main component of this then is that a person is wandering through life and something happens which triggers them into a dissociative event, whatever that may be. It might be a loss of memory, it could be a depersonalization experience, it could be a switch into a different alter, or it could be a jumbling of voices or concerns or emotions or sense of reality that's going on within inside the mind. Many things can happen as a result of what could be a fairly simple trigger. And what we want to do is try and work out how a person can immediately work through that dissociation, ideally to prevent it from happening at all, but if it's already taking place, to intervene as early as possible and reduce the intensity or the ultimate experience of that dissociation so that the person can remain present. What's going to be needed is time. So the first video looking at this was all about the timing of dissociation. This is now about whether there's enough time to be able to manage it. What we're looking for is enough time for you or the person that this is happening to be able to ask the question, am I safe? So that might take 5 seconds, it might take 10 seconds, and often that can be enough. If the time isn't available, then more work needs to be done, but this is something that a person can work towards. And some events will always allow this time because a person can sense that the dissociation is coming on over a period of time, 5, 10, 15, 20, 30 seconds maybe, following that trigger, and that gives them enough time. Not always, but if there is enough time, then there is something that can be done about it to help. And that's good news. So to ask the question, am I safe, we need an answer. So we're looking at visual cues, we're looking at auditory cues, sensory cues, basically from the environment. So what I encourage people to do in clinical settings is when they're dissociating in the clinical room or beginning to dissociate, we stop and I ask that person to look around and say, is there danger? Is there threat? Am I safe? And obviously within the clinical setting, there is none. So they may have been triggered by a memory or a thought or something that took place. It could be a noise outside the room. It could be anything that occurs that triggers that person from a trauma in their past to the present day. So asking that question, is there any danger here? Is there any threat? Can I see it? Can I smell it? Can I feel it happening? The person looks around the room and they don't see any threat because nothing has changed. It's simply them and me. Nothing else is going on in that room, so therefore they are safe. Now, that is what we're looking to do, is enough time to be able to say that, because the second or the minute the person knows that they are safe, they can then communicate that information to the brain, which is where the dissociation is coming from. Remember that the brain is triggered, right? Not necessarily the person, it's the brain. The brain remembers previous trauma, it thinks that trauma is happening again, so therefore it brings in the dissociation to protect the person from whatever that trauma might have been. But in the present day, the trauma isn't happening in the now, so the brain gets tricked. So you ask the question, am I safe? The answer is yes. You then say to the brain, I've got this, I'm going to be okay, nothing bad is happening, you can stand down. Anything along the lines of, thank you, I appreciate that you're trying to help me, brain, but I don't need it at the moment, I'm completely okay, I'm with Mike, I'm with my therapist, I'm with my friend, I'm completely safe in this environment, wherever I may be, you don't need to help me, I have got control of this, please let me handle this situation. That's what we're trying to achieve, is this new communication to the brain to say, The dissociation that is occurring is not needed because I'm actually okay. You've been tricked. That's what this comes down to. The goal is simply tell the brain that the defense system that it's activated is not needed. It thinks something's happening and it actually isn't. Just because you've seen something or sent something that has triggered a trauma memory does not mean that you're unsafe in the present. Assuming obviously that everything is safe, which pretty much it's going to be. So as long as the body is safe, as long as the person actually is safe from the evidence around you, you're able to say, I'm okay, I'm going to be alright, you don't need to dissociate me from this experience, I can handle this. So what we're looking at is being able to achieve knowledge between the past and the present. If you're able to say to the brain, the past is where the threat and danger was, the present is where safety is, you've been tricked into thinking we're in the past, we're actually in the present is safe, I'm going to be okay. A lot of times when that narrative plays itself out, the dissociation fades away, and what people describe in my clinic is this sense of feeling the dissociation build and build and build, almost like a wave that then doesn't turn into anything. It just subsides, it gently moves away, and the person can almost feel that dissociation ebbing away from them as they sit. It can be quite a tiring process, and again, much better done and considered and practiced within therapy, because your therapist is there to help with the narration, help with the words that are used. But actually, if you're out on a bus stop somewhere, or you're walking through the park, or you're in a supermarket, you can do this. If you feel the dissociation arriving, you can stop, take the time, say to the brain that you're okay, look at the evidence around you, ensure safety is present, and then start building away from that dissociation. So you start building your confidence to be able to say, I do not need to dissociate in this moment in time. So I really hope that this has helped. So watch the first video about the timing of dissociation if you haven't already, and put these two together. One is about why those things might happen, and this one is much more about how you can manage in the moment. Work with your therapist, or if you are a therapist, work with your clients on achieving this level of communication if they haven't already, and watch for the results, right? So you review, you reflect on what worked. Don't expect immediate results, but you might get some really good results. You never know. It's always worth the try. So I hope this video has been helpful. Please do like and subscribe to the channel for further content, and we'll be putting many more videos out as we go along. So in the meantime, please take great care.